I am joined today by our Health Commissioner, Dr. Nguyen, and other team members from our Health Department to discuss our plans to deal with the potential health emergency, the threat of the Zika virus. While the Zika virus has had a relatively limited impact on Maryland and the United States so far, federal and international health officials are clearly concerned about its potential to spread quickly. The fact that there will be so much travel this summer to Brazil for the Olympics makes it more urgent for cities like Baltimore to be prepared. While most people with Zika do not have any symptoms, the impact on pregnant women and their babies can be devastating. If you have seen pictures or read the news accounts, it's heartbreaking. Given that typically we have 9,000 pregnancies a year in Baltimore City, we cannot afford to ignore the potential threat. Back in February, when the state began seeing its first reported cases of Zika, I announced the formation of Baltimore City's Strategic Zika Preparedness Working Group. The working group, which was led by Dr. Nguyen, was directed to coordinate a citywide response in preparation for the potential impact of the Zika virus. It was comprised of high-level representatives from city agencies as well as other stakeholders. I had several objectives that I wanted to see accomplished, including to ensure that we had as thorough an understanding as possible of what the Zika virus is and what impact it might have on Baltimore City residents, to understand what could be done to best protect Baltimore City residents, and to devise a plan of best practices as well as potential costs to ensure that we are prepared for all possibilities. I am pleased to report that the working group has come back with a plan today that addresses all of those objectives. To our knowledge, this Baltimore City plan is the first in Maryland and can serve as a role model for cities not just in our state, but across the nation. Dr. Nguyen will provide more specifics on the plan, but I wanted to highlight a few critical areas, including new mosquito surveillance and control efforts, enhanced responses to calls of standing water that may come from our neighborhoods, Zika prevention kits for the city's pregnant women, new educational materials and public service announcements as well as outreach, and Zika community ambassadors to better reach residents. None of these efforts are free. Our anticipated cost for this effort is roughly $500,000. Though that estimate could go up if the Zika virus is seen to have a greater impact on Baltimore City. So far, the state has indicated that it plans only limited support to local jurisdictions like Baltimore. The state has said it will provide about 950 Zika prevention kits to Baltimore City, enough for only about 10% of the women who should become pregnant this year based on prior numbers. As the summer approaches and as mosquito season picks up, I want to urge the state and the federal governments to realize local governments are the ones on the ground dealing with public health emergencies like this. We can take the lead, but we need the support of our state and federal government. We also need financial support. I want to thank you all for joining us this afternoon. Thank you for your work, and I want to turn the podium over to Dr. Nguyen to discuss more specifics. Thank you very much, Dr. Nguyen.
Thank you, Madam Mayor. Good afternoon, everyone. So I want to start off by first saying that Baltimore has never taken a backseat to public health, and as our mayor mentioned, we're glad to be the first jurisdiction in Maryland to announce our citywide plan for Zika. Awareness is important, but we also have to have action. And this is not easy. Our multi-agency effort has involved high-level representatives from agencies including the police department, fire department, housing, public works, rec and parks, Department of Transportation, Department of Social Services, Office of Emergency Management, the Mayor's Office of Immigrant and Multicultural Affairs, and nearly 20 other agencies. And I wish to thank at this time Deputy Commissioner Don O'Neill, who has been instrumental in leading our efforts, along with the rest of our team, including Mary Grace White and Jennifer Martin and Anya Fries, and who else am I missing? And Cooper Lloyd is here as well, and Sean Nair, who have been really instrumental. So thank you all for your excellent leadership. I'd like to start today with some facts about the Zika virus. Zika is primarily spread by the bite of the Aedes mosquito. Most people who get Zika, as our mayor mentioned, have no symptoms, and those who do, about 20%, have mild symptoms like fever, joint aches, and a rash. The main concern, and I cannot emphasize this enough, the main concern is pregnant women. In Brazil, over the last year, there have been thousands of babies born with microcephaly, which is a small head associated with severe brain damage. Research has shown that Zika infection in pregnant women is linked to these severe birth defects in their babies. Zika, over the last year, has spread rapidly throughout the Americas. The World Health Organization has declared Zika to be a global public health emergency, and the Centers for Disease Control has been activated at its highest level of emergency. As of this week, there have been 388 cases of Zika in the continental US, including 9 in Maryland. So far, nearly all are travelers to the US who acquired Zika in other countries, although it's important to note that 8 cases are sexually transmitted from partners who have traveled. However, with the summer months coming, there will be cases of Zika acquired in the US from mosquito bites. It's also critical to note that the situation regarding Zika is quickly evolving. There is information coming out every day with new research. And scientists and public health officials are working around the clock. And we at the Baltimore City Health Department have been monitoring the latest news, and we're working closely with our state and federal counterparts. This is what we know. As a result of new studies, we now know that Baltimore has the Aedes mosquito that can carry Zika. We also know that urban cities with concentrated populations are at more risk for Zika because Zika are container breeders. They breed in small amounts of standing water. Also, there is no vaccine and no cure for Zika. That's why the best preparation is prevention, specifically vector control, meaning that we have to stop the breeding and the spread of mosquitoes that carry Zika. Virtually every disease is a disease of poverty, and Zika is no different. Every disease is also a matter of the future of our city. The long-term health, educational, and economic costs of babies born with severe brain damage due to Zika are astronomical. We estimate that that could be up to $500 million in 1 year alone in Baltimore. Not to mention that it would be inhumane for us to watch silently when what we need to do is to prepare as a city and as a community. And that's why I'm so grateful to our mayor, Mayor Rawlings-Blake, for her proactive leadership. She has asked for constant updates and briefings about Zika. She has asked that I present to our city council. She has asked that I convene all of our city agencies because this is not just a health department issue. Mosquito control and public education requires all hands on deck from every city agency, from our community, and also from every single resident. We can think about it like flu prevention. The health department is critical for our work in surveillance, for getting information out, for correct public health education. But washing hands is the responsibility of every resident, and that's why we need to get out the word about Zika. So today we're glad to announce the recommendations from the citywide working group on Zika, and there are 2 main components, as the mayor mentioned. First is to develop and implement a mosquito surveillance and control plan. Second is to conduct widespread public education. So first, we will be restarting the mosquito surveillance and control plan, which has been inactive since 2007. This plan involves targeted spraying around positive Zika cases with adulticide and larvicide, which is the CDC recommendations, starting responses to standing water through 311, as standing water is breeding ground for mosquitoes. And we will also have our environmental sanitarians treat standing water that cannot be dumped with larvicide. Conducting mosquito surveillance so that we know where are the mosquitoes that are carrying Zika, and increasing our capacity to investigate possible cases of Zika and conducting community outreach. The mayor also mentioned that we will be putting together prevention kits for 9,000 pregnant women. And we appreciate the 950 kits that we are to receive from state. But we have great need in our city, and we must provide for all of our vulnerable residents. Education will also be a critical component, and indeed this week is Zika Awareness Week as declared by Governor Hogan. But it's not enough to say that we are participating in Zika awareness. unless we have a specific and actionable plan. Baltimore City's plan is robust, specific, and directive, and illustrates that our city is responding to this crisis with urgency, collaboration, and action. Over the last several months, we have already conducted extensive education, distributing educational materials and messaging through media, social media, and community outreach. We are in constant and frequent communication with all of our hospitals and clinics and all the doctors and providers in our city. And we have sent regular update letters and emails from me as the situation with Zika has evolved. We have also distributed educational materials, including those that are translated to all of our city agencies. We're conducting targeted educational outreach to pregnant women, including through obstetric providers, through Healthcare Access Maryland, Department of Social Services, and other entities. And as you've heard from our mayor, we will be enlisting community members to be Train the Trainer Zika community ambassadors, just as we do for community members to help us spread the message about safe sleep for babies, HIV prevention, light pain prevention, and other critical public health messages. This citywide plan for Zika is the beginning of what must be an all-hands-on-deck approach. Zika is a global public health emergency, one that can lead to devastating health, educational, and economic impacts on our babies and many generations to come. Thanks to our mayor, Baltimore City has a robust, specific, and actionable plan that we have already put into place as the first in Maryland and one of the first in the country. In the coming months, we will be enlisting the support of all of our residents and local businesses. We need everyone's help for vector control. For example, even a small bottle cap can be the breeding ground for mosquitoes. We'll be asking residents and business owners to survey their property every 4 to 5 days to look for standing water or other items that can collect water, and to get rid of these items or bring them inside, and always keep your trash can covered. Neighborhood leaders and members can also coordinate cleanups and help those residents who cannot get out to take care of their properties. And we'll be recruiting partners to join our Zika Ambassador Program team, or ZAP team. In the meantime, we continue to work with our state and federal partners to request funding for Baltimore City. Our urban cities, especially areas with concentrated populations and concentrated poverty and disparities, will be the hardest hit by Zika. We ask that resources be targeted to areas most at risk, including Baltimore City. So I thank our mayor, our fellow agencies in the city and state, and my outstanding team at the Baltimore City Health Department for your hard work and for developing and implementing a plan for this rapidly spreading disease with urgency, collaboration, and action. Thank you, and
We'll open up for questions.
What's in the prevention kits that you guys are going to be handing out?
that's a great question. I believe that we have a graphic about this as well, or maybe it's not on this graphic. Is it on the graphic? Well, I'll explain what's in the prevention kit. So the most important thing that's actually not in the prevention kit, because this is something that people can do every day, is to get rid of standing water. The most important thing that every single resident can do is look around your property. If there is even a small bottle cap, any empty containers, flower pots, old pet bowls, those are things that we should be looking for those are things that we should be getting rid of every day, because that is what will hold standing water. In the kits, there are condoms, because again, Zika can be sexually transmitted, and the recommendation for pregnant women who have partners who have traveled to countries with Zika transmission is that they should abstain from sex or use condoms every single time. What else is in the kits also include insect repellent, because really important for every single person, especially pregnant women, but every single person to wear insect repellent, and also long sleeves and long pants to cover up.
Any other questions?
Mayor, you touched on it before. You said that $500,000 is kind of just a start, and you need more support from the state. Can you elaborate on that a little bit? I feel like so many times when we talk about Zika, everybody keeps saying it's not enough money and we need more money. Can you go into more detail?
Right. So we're estimating, based on our past history in the city, that it will take about $500,000 to do our preparedness as well as to treat the water. So we have plans when people call in, so we're going to be able, and as Dr. Wen talked about, to do the vector control. It's not free, right? So when you call in and say that there's a standing water problem, when we go out to treat it every single time, there's a cost associated with that. And we're paying for the Zika preparedness kits that we're going to be giving to the pregnant women. As we said, about every year we have about 9,000 women that are pregnant. The state is offering 950 kits. That leaves a significant amount of kits that still need to be purchased on top of everything else. So when we talk about support from the state and the federal government, it's because these mosquitoes don't know where the city line, the city ends and the county begins. And when you talk about federally, they don't know where Maryland ends and Pennsylvania begins, or Virginia. This is a potential epidemic that is important to the CDC, that is a nationwide problem. So I think we need a nationwide response. That being said, we're not waiting for anyone to create a plan that will best protect Baltimoreans.
Where is the money going to come from, the $500,000?
We've identified general fund sources. The specific accounts, I don't have that information, but there will be general fund appropriations, with hopefully support from emergency management as well.
Is the state giving you any money at all besides the 950 kits?
I don't know.
So the state has said that this is an issue for local jurisdictions to handle. They are excellent supporters and collaborators, and certainly have helped us with contracts, including with the Maryland Department of Agriculture for spraying in targeted areas of Zika. I do want to mention that, as our mayor said, President Obama and the CDC have asked Congress for over $1 billion of appropriations for Zika, recognizing that prevention is critical, that we can't just look at what might happen once we get hundreds, if not thousands or more, of babies born with severe birth defects, that we have to look at prevention. Unfortunately, those funds have not yet come through, and that's why it's so important, and I'm so grateful to our mayor for taking proactive action to say that our city cannot wait while Congress is involved in these budgetary battles.
There's been some conflicting information given out over the last few months about whether the Zika virus is likely to come this far north and have cases that originate here in Baltimore. Do we have any idea? Do you have any idea of how likely it is that it would actually originate here in the Baltimore area?
We've identified the Aedes mosquito is the mosquito that carries Zika. We have that here, so we know that we're a potential site, and that's why I thought it was important to convene the group. And also to have a working plan, so we're not behind the 8 ball if we were to have an outbreak here. We want to start as soon as possible with education, with outreach, with the prevention kits, so we are better prepared.
Do you have a timeline for when the spraying is going to start?
The recommendations from the CDC are that we have targeted spraying in areas where there are cases of Zika. So we do not do blanket screening. That is not science-based. So and it's not effective, and it's not science-based. And so the recommendations from the CDC are that when there are cases of Zika, that there is spraying and around those specific cases. And so we do not yet have a case of Zika that is locally spread here in Maryland, and so we're not spraying yet, but we are getting those contracts in place. And we do want to, again, stress that because the Aedes mosquito is a container breeder, that's why it's areas that are the most densely populated and urban areas that are going to be the most heavily affected. So it's not the Eastern Shore, it's not the places that are near the bay, as one might initially think of when you think of mosquitoes. This particular type of mosquito is different because it's a container breeder in populated areas.
Thank you.